Welcome to another Better Health Together, and you'll see that I have with here our esteemed Health Minister, Roger Cook.
Good morning.
Good morning. And Roger, I know that this is a topic that is dear to your heart. We've talked about this, and in fact there was a summit last week on obesity.
Indeed.
And it's a major issue. I'm really, firstly, interested to hear what you perceive to be the impact of obesity, both on the health system, but also in WA.
Yeah, look, obesity wrecks lives. Let's be very clear on this. It's an inflammatory disease which is associated with poor nutritional or underactivity. And the outcomes of that are devastating for the individual in the form of chronic disease, early death. Obesity is a sea of misery.
Yeah.
So all governments have got a job to try and help people avoid that journey. But also it makes sense from a government's point of view to ensure that the 2/3 of adults that are obese and the 1/4 of the kids that are obese aren't so much a burden on the health system. So you might be interested to know that over $240 million a year is spent by the WA government on obesity-related healthcare costs. And so it makes sense from a point of view of people's well-being to have obesity as a priority policy concern for any government. But obviously, as everyone, taxpayers, it makes sense for us to address obesity simply because it's really expensive.
Yeah. And to be fair, obesity or people being overweight nearly is a norm rather than an exception. So it is a concern, I think, broadly. I'm interested to hear from your perspective what the WA government is starting to think about doing or contributing to this.
Yeah, well look, governments have an important role to play, not only in terms of avoiding costs, but in increasing well-being. So obviously, the West Australian government has a proud history around some of these public health campaigns. The Live Lighter campaign is nation-leading and is an important part of a mass media campaign to spread the word about how people can avoid falling into overweight or obese categories. In addition to that, breakfast programs at school is an important part of informing young kids about how to get them into good behaviours around nutrition. And one of the things we've launched in Western Australia is, of course, the Sustainable Health Review. Yeah. Now, the Sustainable Health Review is about looking beyond our hospitals and saying, what do we need to do to have a sustainable health system and move forward together as a community. And in the interim report, which reported in early February, it identified obesity as a really important target and obesity prevention as an important priority for the health system, making sure that we spend more than just the 1.4% we do on preventative health measures at the moment to really make it everyone's business, particularly the state governments.
Yeah. And look, I think primary healthcare has a key role. There is no doubt that if a clinician can mention to a person their weight's increasing, let's start early, let's not let this get away. It's much harder. But if you had your way, if you had 2 or 3 key things you wanted to achieve, what would those things be across this topic of obesity?
Well, look, governments can do just so much. We can throw money at this problem, we can build bigger hospitals to have more sicker patients in it. Yeah. But who wants that as a future for Western Australia? We aspire to a healthy, happy community. So it goes beyond governments.
It does.
Obesity and obesity prevention is everyone's responsibility. And we really need to make it as part of a national conversation. Look, this is about the importance of creating active communities. Public transport has a huge role to play so people can live more active lives, get out of their cars. So it's a holistic thing. Recently at the COAG Health Council, I raised the issue of the federal government launching a national obesity prevention strategy, which is about saying, as a country, how can we do better? Yeah. How can we live happier, live healthier? And this goes beyond a question of health and healthcare. This is about how we as a community come together to live happier, healthy lives.
Thank you very much. This is a really key topic and we're very happy to share your views, because I think they're important views for not only the primary healthcare setting, but industry at large, to understand this is everyone's issue, not just ours in the healthcare system. So thank you very much for your time.
It's a pleasure.